Dr. Joe Niamtu, LoveThatFace.com, and today we're going to talk about a very common situation. Patients in their mid-40s to their 50s and on start to develop small little pouches here of lymphodematous tissue, and lymphedema is just boggy tissue. It's a kind of waterlogged tissue, and we get these little pooches here. They're called festoons. Some older patients have them severely, but young patients start to get them, like I said, in their mid to late 40s. And you can laser these. There's really not a lot of great treatments. The laser is the best, but you have to laser the whole face. However, you can take filler and masquerade and fill in the area around the festoon. So it's almost like that festoon is a little swelling, a little mountaintop that sticks out on the cheek, if you will. And what we're going to do is fill in all around it to make the whole cheek one level and build this in so we have a nice, fluent, and smooth contoured cheek. So you'll watch us do that right now. Okay, so we're going to be talking to a patient. This is a typical patient that comes in, and they want to freshen up, and what they're dealing with are what we call festoons, which are these little pouches that appear on the cheeks. And these are actually boggy tissues that have kind of abnormal amount of fluid in them, and it's pretty common, especially in females as we age. Now, we could laser these and really tighten them up nicely, but obviously that has recovery. And so this patient is interested in some one-stop, immediate rejuvenation. So we have a little tear trough and what I call cheek trough action here. And what we want to do is to sort of fill this area so we can add some youthful volume here, but we want to do it in a way that it blends at the same elevation as this festoon. So if we build this part up, the festoon won't be sticking out. And again, we're going to add some youthful volume in this area, which I call the cheek trough, but it's going to make that festoon blend in better. So in pursuit of these festoons, our goal is going to be to inject around them to blend in. So what we're going to do is fill in the periphery around the festoon, because we don't want to make the festoon bigger. And it doesn't take a whole lot of filler to do this. Just a little pinch here. We're under the orbicularis oculi muscle. And most patients, as they age, they get this little groove here, which I call the cheek trough, and it goes from the tear trough down into the cheek. Now let's put a little Vaseline there. And you can see just in a half cc, and it may be hard for the observer to see because of the overhead lighting in here, but with a half a cc, we have blended this in. And we're going to put just a little bit here in the tear trough. We're under the orbicularis. Again, you can see I make a little bubble there, and then we'll just walk that filler over. A little Vaseline here. And this is shaping up nicely. As you can see, we're using Ultra Plus here. And so now we're going to just get a little bit more up into this tear trough. So I'll make a little bolus and walk it over. And that's looking nice, and it's masquerading that festoon. So this is the untreated side, and if we turn here and look at the treated side, we have a nice contour, and you can no longer see that festoon that occupied this space. So now we're going to do a similar thing over here, and this side is not quite as bad. This festoon is not quite as big. So we're going to inject a little bit, and we're going to get up into this cheek trough. And here's where we want this nice rounding to occur. And we're going to sneak up here under the tear trough a little bit. Again, I'm under the orbicularis muscle. And the beautiful thing about placing the right filler in the right tissue planes is that, and put some Vaseline on here, is that you can really work it. You can make it go where you want it to go, and you can smooth it so it's not lumpy. And just with that little bit, this is really making a nice difference in that area. So if we look at this patient now, you can see that there's no visible festoons. Now we can take some more filler and increase the cheek projection here, but of course we'll let the patient look in the mirror and decide that in a second. Hi, I'm Dr. Joe Niamtu, CosmeticSurgeryEducation.com, and I hope you enjoy our free YouTube videos. I want to talk to you a little bit about our for-purchase video series, and if you follow our education platform, you know that in the past I had a very successful DVD cosmetic surgery video series that you would order on DVD. To become more contemporary, we've done it all over, and now it is all online. I spent 2 years and recorded over 300 hours of 1080p high-definition video, and it's fully narrated in a step-by-step teaching manner. This includes, but not limited to, topics such as blepharoplasty, brow lift, minimally invasive facelift, traditional facelift, facial implants, otoplasty, laser resurfacing, chemical peel, injectable fillers, neurotoxins, mole removal, the management of fat in the head and neck, and other topics. I think this is a great review for experienced surgeons and a great teaching tool for students, interns, residents, or anybody that wants to learn about cosmetic surgery. If you go to CosmeticSurgeryEducation.com, you can preview any video, and they're very reasonably priced. When you order a video, you can stream it 24/7, as well as download it so you own the video. I'm really excited, and I think I put together a really awesome teaching series. Check it out, CosmeticSurgeryEducation.com. I'm Dr. Joe Niamtu.